This is a short video on the anatomy of the sternum. So the sternum is divided into three parts. There's the manubrium at the top, the body in the middle, and the xiphoid process at the bottom. The manubrium has a jugular notch, which is located in the middle, and then there's two clavicular notches at the side, and those articulate with the sternal ends of the clavicles to form the sternoclavicular joints. It also contains a facet called the costal notch, which articulates with the first rib, and contains a demifacet which partially articulates with the second rib. The sternal body also has costal notches, and they articulate with ribs 3 to 6, and it has demifacets which articulate with parts of the second and seventh ribs. Altogether, on the sternum there are 7 costal notches, labelled from 1 through 7, with number 1 being the most superior and number 7 being the most inferior. The manubriosternal joint, there's a palpable region called the sternal angle located between the joint. And finally, the xiphoid process is the bottom bit, and it's a site of attachment for the diaphragm, and the tip's located at T10 vertebrae level. So if you count these vertebrae, it'll end up at around about the 10 thoracic vertebrae. And in sum, the xiphoid process articulates with part of the costal cartilage of the 7th rib. So if you count the ribs, this 7th rib would sometimes articulate the xiphoid process. And if you look back at the costal notches of the sternal body, it says articulate with ribs 3 to 6. So you can see that ribs 3, 4, 5 and 6 all articulate with the sternal body, and so does 7, but in some cases it'll go to the xiphoid process. And ribs 8 to 10 are false ribs, meaning they attach to the costal cartilages of the other ribs that attach to the sternal body. And ribs 11 and 10 are the floating ribs, which means that they don't attach to the sternal body at all.